Hello and welcome to The Society with Fatma Shaheen at PTV World. As we all understand, polio unfortunately still remains to be one of those diseases which Pakistan is hit by that virtue, meaning that of course polio is endemic in Pakistan amongst the very few other countries. And for this reason today on our show we'll be talking about not only the disease itself as it does exist, but we'll also be talking about its various signs, its symptoms, and of course the work that is being done both by the government in this regard and of course international partners when it comes to eradication and fighting off the same. Today on our show we'll be talking about the various initiatives that the government of Pakistan has taken when it comes to eradication of polio. In this regard particularly we'll be talking about not one rather various polio immunization campaigns which are running. We'll also be talking about of course the need to improving surveillance and by that yardstick of course the vaccine quality itself. In this regard we'll also be shedding light upon the fact that when we do talk about of course eradicating polio, what responsibility then lies on the society at large in this regard. And last but not the least, we'll also be talking about the need for there to be greater collaborations and of course coordination with of course international stakeholders and stakeholders otherwise when it comes to fighting off this very disease. This and much more to follow on today's show, that too with an extremely diverse panel. Let me introduce you to my today's panel. My first panelist for the show today is Dr. Rani Sabha. She is a consultant child specialist at Services Hospital, Lahore. Assalamu alaikum ji and welcome to the show.
Thank you so much.
You're most welcome. Alongside her, I have Dr. Naeem Majid Saab. He's the technical focal person, Immunization Punjab. Assalamu alaikum ji and welcome to the show. And my third panelist for the show today is Mr. Khizal Afzal Chaudhry Saab. He's the Emergency Operations Center Coordinator Punjab, alongside being the Additional Secretary, Primary and Secondary Healthcare. Assalamu alaikum sir and welcome to the show.
Thank you very much, ma'am.
Now before we start the conversation on today's topic, let's have a look at this brief report.
Pakistan is unfortunately one of two countries where polio remains endemic. However, there is a massive decline in polio cases thanks to widespread efforts by the government and its partners. Polio is a crippling disease and has no cure, but there is a safe and effective vaccine.
Polio is basically a disease of a virus, poliovirus, and it primarily affects the spinal cord, and in the spinal cord is called the anterior horn cells. And once it affects the anterior horn cells of the spinal cord, the area they supply, that part of the spinal cord becomes paralyzed. And that is why, you see most of the people with polio, either they don't have a working limb, like a leg or an arm, or many times, both the legs. So this is a disease which spreads through orophycal route as well. So therefore, people who get vaccinated for this disease, they normally do not get the disease. And to prevent its spread in the society, two things are very important. One is the hygiene and other is the polio drops.
Experts believe that there is a need to debunk myths about polio vaccine.
Most of the people, they think that by taking this vaccine, the child will not be able to produce the child after married life. There is no any sense in this sentence. So I must make it clear that everybody in our country, they are taking these vaccines, their polio drops, but we have seen that they are producing children, they are fertile. So this is just a propaganda. So our religion even says that we should protect our offspring by diseases which can be prevented. And this is, I think, this is a very deadly disease, but it can be easily prevented through vaccination. So I'll request all the countrymen that please, whenever there is a campaign of polio eradication and the drops are given to the children, you must volunteer your children up to 5 years of age.
Pakistan has made tremendous progress in the fight against polio, yet more needs to be done.
We just saw this report. Now to get the conversation started with you, Dr. Saab, I think first things first, when we talk about the disease itself, for the clarification of the audience, can you explain what particularly is it which causes the polio virus disease? And of course, having said that, what are the types which are still prevalent in Pakistan?
Fatma, polio is a debilitating viral disease that is called by a polio virus. And that polio virus is an RNA virus containing 3 basic types, 1, 2, and 3.
Right.
2 and 3 have been globally eradicated, while 1 is still prevalent in Afghanistan and Pakistan. Nigeria has been recently left out.
Right.
So Pakistan and Afghanistan still have type 1, and we are dealing with this issue at the moment. The basic signs and symptoms that we encounter with this polio is 95% of the kids that usually have it, it doesn't show any symptoms.
Right.
But the remaining 5% might develop mild symptoms in the form of abortive polio. And these have fevers, myalgia, sometimes headaches.
Some even complain, I was going over this report which suggested the fact people also have flu-like symptoms. So that is also another mild category. But then Dr. Saiba, how do you scientifically, rather medically explain the fact some people, whenever they do get polio, it is something which very mildly affects them, and some people, when they do get it, something which really gravely impacts them?
Reaction, the basic reason is that the nutritional status and the immune status of the kids is very much important regarding this disease, because Pakistan comes under the higher levels of undernutrition under 5 years of age. So that's why our kids are very badly affected with that disease. And regarding this, the immune status as well is very important. Like any other viral diseases, this also has a greater impact on the decreased immunity kids, such as chronic debilitating diseases, patients suffering from HIV, and any of the immunosuppressive drugs that the patient might be using at that time.
Right. So basically, it's not then just one thing, it's a combination of various factors. Onbit sir, I'll come to you. We must also talk about this recent polio eradication campaign, which has kicked off in Punjab and Sindh from the 13th of March particularly. So would you be kind enough to tell us that when we talk about the scope of this campaign, what are the districts that are being targeted, and why are those districts particularly been chosen? Because we also understand that this is something which is not all encompassing. Particular districts per se have been chosen, and there the immunization programs are being run.
Actually, the national government, it takes lead in the overall polio eradication program.
Right.
All the planning it's done at the federal level. And then we have this national EOC, and it is led by a national coordinator, which works under the Ministry of Health, Federal Ministry of Health.
Right.
So at the start of every year, they go through a rigorous planning phase in which they decide that how many national immunization campaigns are going to take place in which province. And likewise, this year around, this is our 3rd campaign. First quarter in Punjab, we had 3 campaigns, and this the most recent one, it has started on 13th, and it will continue till 19th of this month.
Right.
The districts in which these campaigns are carried out, the criteria for selecting these different these districts, they vary actually.
Right.
And it starts from the sensitivity with respect to the movement of Pashtun population, which we call it priority population. Secondly, then there's another criteria which we call as environmental samples.
Right.
In certain districts where environmental samples are positive, we have these campaigns, mandatory campaigns rather. And then there are certain very high-risk districts which have this history of having positive polio positive polio cases or positive polio environmental samples.
Right.
These districts include Rawalpindi, Faisalabad, Lahore, Bahawalpur, Multan, and for that matter, Sialkot as well. So there is a planning process after which these districts for the campaigns are selected.
Right, sir. Onbit sir, I'll come to you. In this regard, we must also talk about the various challenges that people like yourself who are taking a lead in the immunization program, you people face that too, particularly in the field. So for the clarification of the audience, when we talk about the efficacy of all these immunization programs, what are the basic, rather the most grave challenges that you people face? Is it of that vaccine hesitancy that we often hear of? Is it, that lack of access that people do have, of course, to people like yourself, or for that matter, at some level or the other, weaker management?
Okay, so it is not so simple. Basically, the API program, it provides vaccines against 12 diseases. So polio is one of them. And for other diseases, we have a good coverage. It is not 100%, but like in Punjab, we have 88% coverage for all antigens. So all the children of Punjab, 88% of the children of Punjab have received all the vaccines which they should be receiving. However, for polio, it is because we are globally committed to eradicate the disease. So in order to eradicate, we have to reach every child every time. And 100% coverage has to be achieved, and every child might have received polio vaccine at least once, but to eradicate it, it has to be given during every campaign. So this becomes the challenge, because reaching every child every time is
People generally, they fail to understand the fact one injection in itself is not something which will give you lifelong immunization. And this is something which perhaps would add to your issues, to your challenges too when it comes to immunization basically.
Yes, exactly. And because we have to give it orally, oral polio vaccine has to be administered every 3 to 4 months so that the transmission chain can be stopped. So in order to do that, we have to reach every child every time, and the hesitancy also comes from the people, because they will say that you came just last month and again you have come.
Why are you here again basically? So these are the issues that you need to work on.
So these are the things which we try to address through media campaigns, through counseling of the patients, of the people.
In this regard, madam, we should also talk about, of course, the disease itself. One thing which is often ignored is the fact polio per se also has a psychological impact on the person who is, a victim to it. So in this regard, as somebody who has had the benefit of treating perhaps quite a few people from this very disease, how do you explain the psychological trauma which does impact those who are suffering from the disease?
I would like to put emphasis on the basic thing that the polio is such a debilitating disease that it causes a permanent paralysis to that person.
Right.
So there is a social stigma that is attached to that permanent paralysis. The kid is usually suffering from certain psychological issues as well at that time when he suffers from this disease. And it doesn't just ends there. There is a post-polio syndrome as well, which might lead to joint stiffness and body pains and certain other issues that the kid might have to deal with.
And this is, I believe, something which worsens with age.
Obviously, the kid can be affected at any time, so we have to take these things into account. Along with that, we just don't provide the physical rehabilitation. We have to put emphasis on the nutritional aspect as well. We have to make sure that the other siblings of that person is already has been immunized or not. We have to provide a psychological support to whole of the family. It puts a certain burden on the whole of the family as well. So financial issues are there, and along with that, there are certain psychological issues in the form of major depressive disorders associated with polio as well.
Right.
So government has provided a certain program in the form of an institution which is a PSRD. It is a Pakistan Society for Rehabilitation of Differently Abled Children. It also provides a vocational training. It provides prosthetics and orthotic support to these kids, and other than that, it gives a certain skill to these children so they are able to perform fully with their disability as well.
Here the emphasis should also be on the families. In this regard, sir, I'll come to you. What focus is placed on not only educating and sensitizing the families of polio survivors, but also in helping them kind of rehabilitate back into the society? Because at the end of the day, this is something which just doesn't impact the person per se, whoever is affected, it also impacts the family at large.
Yes, indeed. Actually, this is the focus of our program. We try to educate not only the families, but we try to educate their relatives in case a child is suffering from polio. Because we try our level best that there is no positive polio case in Pakistan, but God forbid if there is any, the duty of the government is to help and assist the family and the child.
Right.
Because then we have to rehabilitate the child. We have to give them confidence that polio is a disability, okay, it is a non-curable disease, okay, but that is not end of the life. And we try and make others realize as well that this is an example. Those parents who are kind of reluctant in any case to let our teams administer polio drops to their children, we give them examples of those who are suffering from polio. We give the examples of those families who are going through this mental trauma, that their child is suffering from polio and he or she won't be able to run or walk properly in entire life.
Right.
And this actually gives a fair idea to everybody around that these 2 drops are not only going to help their child live a healthy life, rather it will be having an impact on entire family.
Of course, and the community at large, sir, at the end of the day, on which I'll come to in this regard, something which you earlier mentioned as well, is the fact when we talk about sensitizing the families, it's equally important that we also sensitize the communities at large. People who do have some kind of an influence, which of course also includes religious leaders. So when we talk about public education of the community at large, how particularly is that done during the course of polio vaccination programs?
So the communication is an extremely important aspect of our program, and it has been there since the start. And as you are also aware, the lady health workers are also going door to door. So they are not just doing awareness with the families, they do sessions with the local community leaders as well. They also talk with the local influentials like some religious leaders, some mosque imams and the school teachers of those areas. So we engage all of them for the local community level engagement. And then we also do communication with the groups like like there is some association of the Pakhtuns in Lahore and in Rawalpindi and also in other districts. So we go through them as well, we negotiate with them, we tell them that this is important for your children. So it eases our access as well. So otherwise, if there is some resistance, it gets
it makes them more effective at the end of the day. And this is something that we saw during the COVID-19 pandemic as well, where at least religious leaders, they had a very positive role to play with regards to dispelling so many myths which were actually being attached with the COVID-19 vaccine, on which I'll come to you, Dr. Saab. We must also, of course, talk about, the discrepancies which are allegedly said to exist between young girls as opposed to young boys getting immunized. So as a child specialist yourself, what reasons do you attribute to such discrepancies?
Certain discrepancies obviously exist because of the gender inequality that is present in the Pakistan at the moment, but it has improved in the previous years due to the presence of positive social media presence, and gender inequality in at least urban areas have been curbed a lot. And so we are not facing that much issues regarding vaccination of females and male child, but in rural areas obviously it's such a big issue to deal with that they don't get their female child inoculated at the right time. They think that it's not actually important. Although we have seen that the male children under the 5 years of age, they are usually more prevalent regarding this disease. But females are likely to develop this disease in their adulthood.
Right.
So
and pregnant women, I believe, are more vulnerable.
Our nutritional status is obviously the immunity at that time is very important. So female which are usually pregnant and are debilitating diseases such as AIDS and other chronic kidney diseases, patients on anti-cancer therapies or steroids, these persons are usually more at large, more prone to have this virus.
Right. Sir, coming towards you, I think we must also, of course, talk about, not only the polio immunization aspect, and we also have to work, and the government has been working with regards to enhancing the surveillance. By that regard, also improving the quality of vaccines which are actually being provided or procured. So in this regard, could you tell us, be it with regards to different stakeholders, for that matter, civil society, or for that matter, international partners, how is the government of Pakistan working in collaboration with different partners so come together with one objective, that too of eradication of polio?
Indeed, the government of Pakistan is working with a vision, and the vision is to eradicate polio by 2026, inshallah ta'ala. And as I have already mentioned, that it's the federal government which takes lead in planning and executing the entire polio eradication program. All these partners, they assist the government of Pakistan and other provincial governments with technical as well as financial support. And the basic aim of all the partner staff and the governments, provincial and the federal government, is eradication of polio from Pakistan. Because unfortunately, Pakistan is one of the two countries where polio is prevalent still.
Right.
And most recently, Nigeria is one of those countries which have successfully eliminated polio. Since we and Nigeria, we kind of share the same problem set. When we speak of population, it's almost the same. And when we speak of overall our economic conditions, we can compare Pakistan with Nigeria in certain aspects.
Right.
So the aim is to eradicate polio the way Nigeria has done. And our partner staffs, they are assisting us under the umbrella of federal government, and all the provinces, they are working day and night on this. Alhamdulillah, Pakistan is polio free since October last year. We had certain cases in KP, but the good thing is that initially all those areas in KP which were inaccessible for polio teams, now the polio campaigns are taking place there.
Right. So basically, in continuation to what you said then, for the clarification of the audience, it would be very important for you to clarify that when we talk about, of course, the role of various international partners which you have mentioned, what is their role specifically? Is it just limited procurement, or for that matter distribution of vaccinations, or for that matter does it go a step ahead and also ensure that the community at large that is sensitized?
These partner organizations, they are actually performing very diverse kind of functions. When we speak of, for instance, WHO is providing us not only the financial assistance, but it is also providing us technical support. Because the people working in WHO Pakistan, these all are the experts or the consultants who have worked in certain areas where there was polio prevalent previously, but now they are polio free. So they come to Pakistan with an experience and very relevant experience. And when we speak of UNICEF, UNICEF is not only providing us the vaccine, but UNICEF is already also working on community mobilization. Likewise, Rotary International, Bill Melinda Gates Foundation. So they are actually performing diversified functions in form of financial assistance, in form of technical assistance, and most importantly in mobilizing our community, working with the priority community, and they are also kind of helping us engage the priority community by providing us language appropriate stuff. For instance, in certain areas where we have Pashto speaking population. So they help us by engaging priority community and the people from their own community, who can go to the localities where Pashtun are living, so that there is more acceptability.
Right. So, and I think in this regard, it's be fair to also infer the fact that when we do talk about, of course, ensuring that the polio immunization campaigns, they are effective, we also have female polio workers carrying out the same, because a lot of times we see a lot of reservations are being raised on part of the caregivers, or for that matter parents, because they don't feel that comfortable when male members come so as to vaccinate their female child. And you would have a narrative to add in this regard, because a lot of times we do see that not one, rather various myths are being attached with polio vaccine per se. So as a child specialist in your own right, what are the most common myths that you come across, and how would you use today's platform to debunk the same?
There have been various myths and misconceptions regarding vaccines in general. It's not just the polio vaccine. In general, all the vaccines, they are thought that the vaccines are not halal. So to curb these kind of myths, Pakistan Drug Regulatory Authority actually had to conduct a test in 2015, and it deemed it completely safe of alcohol and of the anti-pork or pork fat usage as well. So it's completely halal. And along with that, we have taken fatwa from all of the Islamic countries, especially the Saudi Arabia, and all of the madrasas from here, and our religious scholars have deemed it completely safe as well. The second myth that I usually encounter is that if a kid is already sick, he is suffering from diarrhea or any other viral illness such as flu, so he might not be getting infected, he might develop the disease after getting the vaccination.
Basically, in other words, that it's not then safe to actually give anybody a vaccination if they are already sick. And what about this very common misconception which we've most often heard about? It causes infertility in women.
Initially, it was actually a misinformation that usually spread due to, obviously, media also have its negative impact as well. So this misinformation was usually widespread that this vaccine has anti-fertility role as well. But I would like to again put emphasis that the DRAP and WHO-led laboratories are the one who actually take care of this issue, and there is no such content or any hormone present which can lead to infertility in female or male children likewise.
Both, basically.
Yes.
But we also see, sir, your narrative here is very important, that, media has also played a very positive role. Quite often we do see ads being played to that effect, where very particularly different kind of myths which do surround polio vaccination, they are very overtly being debunked on TV. So as somebody who is heading this program on part of the government, how particularly do you feel can media be used? Because I also understand the fact you've collaborated with various celebrities, with people of influence, so as to get your message across that too in a more effective manner.
Lately, media has played a significant role in helping our initiative of polio eradication. And I think that since this is an age of media, social media, electronic, print media, all these media handles, they have helped us in a way that our message has gone to the places where it has never reached before.
Right.
As a result, when we see the stats, the number of refusals which we used to have like 10 to 20 years ago, they have come down significantly.
Right.
So refusals, if we speak of refusals, they are almost negligible. The only problem which we face these days when it comes to the myths attached to the polio vaccine is that the people keep on asking that why do we need this polio vaccine every month?
Right.
Because we are having these campaigns again and again.
Right.
And the only thing which all of us, Dr. Sabha is sitting here and Dr. Sabha also, we need to convey to the parents is that polio virus is one of the smartest virus alive this time around. And the polio virus knows where to attack. It exists in the gut of children or even the grown-up men. So if we don't administer these polio drops again and again, the resistance against this virus will not be enough to fight the disease.
Right, sir. On which I'll come to. I think you would have your own medical perspective to add to this. So when we do talk about dispelling and doing away with all these myths, part of the problem, which he very rightly so mentioned, is the fact that a lot of times people take a back seat. They are kind of reluctant to get their children vaccinated just because the polio vaccine workers, they come again and again, which of course seems like a burden to them. So for the benefit of the audience, would you be kind enough to explain to everybody that when we do talk about a vaccination of polio per se, why is it so important for this to be a continuous process? Because we do understand the fact polio vaccination is that one vaccination, which of course by virtue of a one-time administration doesn't give you lifelong immunization.
Yeah, so this is an important question which people also ask us repeatedly, that why you are vaccinating every few months. And the answer to that is that it is different from other diseases. So like for measles, we give 2 shots and the person is protected for lifetime. And the person's carrier status is also, I mean, he cannot transfer the disease from one to the other. But in case of polio, if someone gets this injectable polio vaccine, which is the inactivated polio virus, so that person is protected himself, but he can still be a carrier or transmitter of the disease from one place to another, because the route of transmission is orofecal, so it gets transmitted through the sewage and wastewater. So in order to ensure that this transmission is blocked, we need to give oral polio vaccine, which basically protects the gastrointestinal tract, the stomach and intestines from storing the polio virus and shedding it later
Right.
on.
So it has to be then ideally a combination of both OPV as well as IPV, because it is said, and you know, correct me if I'm wrong, that the IPV vaccine per se is more, it has a greater, gives you greater immunity cover against polio.
Yeah, it does, but in order to eradicate the disease, we have to go for OPV as well to break the chain.
Especially for a country like Pakistan, where of course the disease still exists. But moving on, sir, in this regard, what would of course, you know, be interest to the audience would also be that practical aspect of you people going out there, doing all your door-to-door campaigns and the process of which you actually immunize basically children, but the problems that you do face and how particularly do you overcome the same. So if you come across a caregiver or a parent for that matter, who is kind of reluctant so as to get their child vaccinated, how do you kind of counsel them, how sensitize them about the need to get their child vaccinated, why it is so important?
Yeah, so basically the main reason for refusal is, as Khizr Saab also mentioned, that we are going repeatedly, so people get annoyed that why you are knocking on our doors every month, every few weeks, every few months. So so they are reluctant to vaccinate the child. They will say that we just received last month. So it is basically,
or for that matter, even the various myths that she did point out, people wrongly associated with infertility or cancer and so many other things. But how do you, in your own process, in the course of your own job, how do you dispel such myths on ground?
Yeah, so we have a system in which we note the refusals and then they are reported to the senior supervisory tiers. For example, the polio workers, they will report it to their area in charges, then the area in charge can go and do some counseling. Sometimes even our doctors have to go to the doors of those people who are refusing, and then when we counsel them properly, we explain to them how the disease happens, how the vaccine works and why we need to vaccinate repeatedly. So once we explain, there are literally no refusals. At least in Punjab there are no such refusals.
Right. So your point is noted. On which, sir, I'll come to you. I think in this regard it's also extremely important that we do talk about this very imminent challenge polio workers do face, which of course actually revolves around their safety and security, more so in the course of actually carrying out all these polio vaccination programs. What safeguards do exist as to ensure all those people who are actually carrying out these campaigns, who are going door to doors, their safety and security is something which is, you know, taken care of?
Absolutely. Since frontline polio workers are integral part of polio eradication initiatives, their security is, of course, it's altogether, you know, it's a very important subject for us. So we make sure that all our polio workers, they are provided with a safe and secure environment to go to door and help administer the polio vaccine to the children.
Right.
So before start of every campaign, we have several interactive sessions with the security agencies. We have security coordination committees at provincial level, and there is a national security coordination committee at the national level. So all the the stakeholders, including the Home Department, police, law enforcement agencies, we sit together and we make a security plan actually. So that plan is shared with all the districts, and that is ensured by the district administrations and the police administration that all the polio transit teams, they are provided with police personnel. And in case of any incident, any untoward incident, we have very strong SOPs. We do not tolerate such incidents, and we go for FIR registrations. And in case there is any loss of life, God forbid, or property, then we have a robust system of what we call as insurance.
Right.
So we have insurance for frontline polio workers, but we make sure that they are provided with extreme level of security. We had certain incidents in KP,
Right.
but Alhamdulillah, in Punjab, we don't have any such incidents, and we try our level best that the security cover is provided to each and every polio worker.
Right, and I think this would be a greater concern perhaps for not only the law enforcement officials which would be accompanying them, but also for the international partners, on which I'll come to you, madam. And before we conclude today's show, I think it's equally important that we also talk about, the legitimate concerns that parents do have when it comes ensuring that their child is vaccinated against polio. Now, a lot of times we see that parents, they do want to get their child vaccinated, but they want to ensure the vaccine which is being given to the child, that in itself is safe, that in itself has not expired, or for that matter, that in itself has been stored at the right temperature. So when it comes to addressing all these legitimate concerns, what advice would you give to the parents out there?
Fatma, I would like to put emphasis on that the polio vaccine is one of the safest vaccine we have at the moment. It has very less side effects and almost negligible. But the few one are only the like allergic reactions that we have we have with food as well.
Right.
So these are negligible side effects that we should totally neglect at that moment. And secondly, the polio vaccine has a temperature regulatory marker on it. So with the color change, concerned parents can actually regulate or can see that the vaccine is efficacious at the moment or not.
Right. Right, madam, your point is noted, on which I'll come to you, sir. And I think in this regard, it's also very important to talk about the targets that Pakistan has set for itself, both at a regional and global level. So how particularly do you feel can these targets be achieved in light of course, the international commitments that the Pakistani state does have with regards to eradication of polio?
Pakistan government has always committed to the international agreements and commitments. And similarly for health, we have committed to provide health for all. And in that, one of our target is that we have to provide immunization services to all our children, whether it is for polio or for other diseases. So we are working really hard for provision of these services to the people. So there are multiple ways by which the government is addressing this. They are hiring more vaccinators. They have provided vaccinators at the community level. At every union council we have 2 or 3, or in smaller union councils at least 1 vaccinator is there. Then we have our fixed immunization centers as well, which are located at every health facility in the public sector, be it a primary small clinic or a small health unit or a bigger hospital. So everywhere we have provided immunization services. And we are also working on advocacy with the parents and with the community, so that even if our vaccinator does not reach them, they reach to us and they get that.
Right, sir, your point is noted, on which I'll come to you, and in kind of addressing this issue of overall improving the healthcare delivery service system. What is very important is that, we consider this as an issue, and an issue vis-a-vis with regards to the polio eradication program. So as an expert in this field, what would your recommendations be with regards to improving of the overall healthcare delivery system in the country, and by that virtue also targeting to actively eliminate polio from the country too?
Actually, health governance has 2 aspects, preventive and the curative side.
Right.
While we speak of administering polio drops, actually we are working on preventive side.
Right.
If we look at all the developed world, the most of the funding, it goes to the preventive side of things. The basic purpose is that we actually save people from getting ill or unwell. So this is what we try to do. By administering polio drops to the children, we are trying to keep them healthy. We are trying to keep them safe from a disease which cannot be cured.
Right.
And we all know that a society which is healthy is a progressive society. So this is the basic aim. And secondly, when polio is only prevalent in 2 countries, unfortunately, the outside world, it takes it as a threat. To them, the polio in Pakistan is a threat, because since the world is a global village now, people keep moving from one place to another. So they just want Pakistan to eliminate polio. And that is why the partner organizations are working with us. Now it is up to us as a society, as a country, as a nation, that we should realize how big this challenge is. And to help our polio teams, to help all the people who are working in polio eradication initiative must and should be our prime focus.
Right.
All the polio teams working, all the polio teams going to different houses, door to door, my request to parents is, please let them in. Please help them, and do let them administer these 2 drops to your children.
At the end of the day, what is most important is to make them understand the fact by not only letting them administer these drops, they are saving their own child, they are also cutting down on that global transmission, which possibly could be intact if they don't act timely. On which note, I would like to conclude today's show. Thank you so much, Dr. Saiba. Thank you so much, Dr. Naeem, and thank you so much, Khazar Saab, for choosing to be a part of today's show. Well, to conclude today's show, we generally spoke about polio eradication campaigns as they do exist in Pakistan. We also spoke about not one, rather various initiatives that the Pakistani government has taken so as to do away with this deadly disease. We spoke about the massive immunization campaigns which have been running. We spoke about the need to enhance surveillance, and last but not the least, something which needs to be done and of course reinforced again and again is the fact that we need to ensure that the community at large, that in itself is also sensitized about the need to actually get their children vaccinated. At a very basic level, people need to be taught, there needs to be public education on the very particular fact getting their child vaccinated is not something that will save them. This is also something which will help curb the global spread of this very disease. On that note, signing off for today. Until next time, take care and Allah Hafiz.